This is what vaccination fatigue looks like. Since July, vaccination centers in Germany are nowhere near as busy as they were when the campaign kicked off in the spring. At the same time, Germany still needs at least 5 million vaccinations to make it safely through the fall. Around 190,000 jabs are administered every day. The figure needs to be 3 times as many. This is your COVID-19 special here on DW. I'm Janelle Dumalaon. Here in Germany, the slowing pace of inoculations has forced authorities to find creative ways to get things back on track. Have a look.
This is not a typical train ride. It's a new way to drive up vaccination rates. In an effort to persuade unvaccinated residents in Berlin, this train was converted into a mobile COVID-19 vaccination center. On board the moving train, this physician administers the single-shot Johnson & Johnson jab. Now that it's done, I'm relaxed. I'm very happy and proud that I'm done now and with only one shot. Sure, my arm hurts a bit, but I feel fine. Is the number of new vaccinations flattened in Germany? The country's rail operator is trying out something new. Today we have a first-come, first-served method. Those who board will get a shot. We want to see whether the offer will be accepted. That's why Andreas wanted to arrive early at the Treptower Park train station. A friend told him about this campaign. I thought, why not? As it is on the train and you simply have to hop on and sit there and wait to be called. That's it. That's easier for me than having to go to make a doctor's appointment. But his hopes of getting his shot on the train, quick and easy, faded once the train arrived. So many people took interest in a one-day campaign that he and many others had to be left behind due to lack of space. I'm just speechless. For some it was a successful train ride, but Berlin's transit system may have underestimated how popular it would be. The city has been getting more creative with ways to increase the vaccination rate, and several residents here hope more vaccine trains will be scheduled down the line.
Now, just to get you up to speed as to the number of coronavirus vaccine doses administered so far here in Germany, we're at 102,414,255. Those who have received one shot make up 65.6% of the population, while those who are fully vaccinated clock in at close to 60%. Now, with those numbers in mind, we are joined by Klaus Sturr. He's a virologist and epidemiologist. Welcome to the program. Dr. Sturr, you are also the coordinator of the Corona Strategy Platform, where you and other scientists are developing plans to combat the pandemic here in Germany. Tell us, what can we expect?
Well, when it comes to autumn and winter this year, I think we are going to see a significant increase in cases again, with a slight difference to last year. This year, about 20% only of the above 60 are not yet immune. So it's a significant difference. Much fewer cases people can get infected, but 20% in Germany are 4 million people. It's half the population of Switzerland. Above 60, which has not yet been immunized. So these people can still become severely ill. The chance of a person who is above 80 to die from an infection is between 10 to 30%. So nobody would hop on a boat or a train with such an expectation of dying. So there is a long way to go here. And there are also very many younger people who have not yet gone through natural immunization or immunization. Right. And there can also be a large number of cases during the winter period.
Now, very important, of course, to set those numbers in context as you've done. But we do see other countries with high vaccination rates also having to deal with high infection rates. How does this development inform Germany's pandemic strategy?
I hope it would, because Germany has one of the lowest incidences, so the number of cases per day. What that means is that there is no chance for all those who do not want to get immunized or who cannot be immunized to get natural immunization. Many other countries have a type of catch-up effect now. Incidences are at the area of 200, 300, 400. So all those people who are now getting natural immunization with an asymptomatic infection, particularly in children, adolescents, and younger adults, they will in Germany not go through this. And you push pretty much all these natural immunization into the winter period. And that will certainly add to a significant wave of infectious diseases. So Germany will have to have a catch-up here in autumn, also because of last winter, where Germany had very often an incidence half only, or a quarter of what other countries had. So I believe the total number of people who are already immune, beyond those immunized, in other countries is much higher than in Germany. And that's why the risk of a severe outbreak, corona outbreak again in winter is pretty high.
Certainly a warning there for us. Now, you've called for an independent panel of experts and a national commission to advise policymakers. Does that mean you think German policy has been badly advised, perhaps?
Well, what you normally do when you're in a large entity, in a society or in an institution or industry, you have a crisis management committee with an expert advisory group that gives you policy options. You ask for 3 options, possibly one which focuses on health, one on economy, and one on the democratic rights. You ask for the control option to be developed. As the policymaker, you want to know what are the advantages and disadvantages of these options. And at the end, you have to make a decision. And the group which is developing these options is a multidisciplinary team composed not only of patient remote virologists and epidemiologists like me, but also on pediatricians, internists, people who are working in public health on the ground, who are making decisions on hospital hygiene, who are advising homes for the elderly and retirement homes. That such an independent advisory committee is necessary to develop in a structured risk assessment process the strategy as options for the government to decide. And such a committee did not exist. And the only one, actually, which does exist, which is the Advisory Committee on Immunization Practices, has been severely politically undermined by demands from politicians that they should make a decision in such favor and against this, without this committee having the freedom and the right and the mandated task to make an independent assessment. So such an advisory committee, I think, could have helped the government a lot. Also, when looking at, for instance, what is the risk of the variants? What is are children in schools drivers of the pandemic? So there are very many questions where an independent advisory could have helped.
Klaus Starr is a virologist and epidemiologist. Thank you very much for your time today.
Thank you.
Now, here's a look at some of the other stories making news around the world. A key World Cup qualifying soccer match between Brazil and Argentina was suspended on Sunday night in unusual circumstances. Brazilian health officials walked onto the pitch at the Corinthians Arena and stopped the game just 5 minutes in. They objected to the participation of 3 Argentine players they say broke COVID-19 quarantine rules. Venezuela is expecting its first deliveries of coronavirus vaccines obtained via the COVAX system after months of stalled attempts to obtain inoculations through the global vaccine program. So far, Venezuela has been inoculating its population with doses acquired directly from China and Russia, following months of delays in making payments to COVAX. And now it's time for one of your questions. Here's our science correspondent, Derek Williams.
I've been vaccinated twice, but still got COVID-19. Will the vaccine at least help my immune system fight it off?
So you did the right thing to protect yourself and others, and you got vaccinated, and you thought you were safe, and then you got the virus anyway. If you're a breakthrough case, then you're not alone. It's a regular occurrence, and it will continue to happen to plenty of people. Certainly in societies where large percentages of the population remain unvaccinated and transmission is high. But it's important to emphasize that breakthrough infections were expected. Although approved vaccines had high levels of efficacy in trials, some amazingly high, no vaccine is 100% effective at preventing disease in everyone. And that's not what our first generation vaccines even attempted to do. They were designed to prevent people from ending up in an intensive care unit with COVID-19. And the data we have shows that they continue to do that very, very well. So what can you expect if you have a breakthrough infection? Well, one really excellent resource, the Zoe Symptoms Study, which is an app-based project that collects data directly from patients in Britain. There, the most commonly reported symptoms in fully vaccinated people are, in order of prevalence, headache, runny nose, sneezing, sore throat, and a loss of smell. It's not really all that different, actually, than symptoms unvaccinated people reported, although they were more likely to have a fever and a persistent cough as well. But, and this is key, what all of the experts I read agree on is that in fully vaccinated COVID-19 patients, any symptoms are generally much less severe and shorter lived. Because nothing is ever 100%, a few breakthrough patients are, of course, also ending up in hospitals. But current evidence indicates strongly that the vaccines are still very effectively doing what they were designed to do, which is to prevent severe illness in people who receive them by priming the immune system to beat off an attack by SARS-CoV-2.